enjoy yourself. We wish you a very successful 3-day period with LiveWell Initiative, and we hope that you will all live well and enjoy good health and wellness. Thank you very much.
Ladies and gentlemen, my name is GHB2012, and I'm being asked to talk to experts in health, about health. I'm on with my colleague here, moderate the events of the day, but I'll just tell you a few things about health, and from a personal perspective and from an organization's perspective, maybe my organization, just a few things about it. As they say, health is wealth, and really it's something that we take for granted, and it's something that the knowledge of health is continuous. The impact of health on our lives is continuous as we grow old. You know, life is like, it's like that. You peak and then you start going down after a while. Your health starts to be a problem or more of a burden. But the key thing is to have the awareness and also the ability to manage your health at all times. I mean, knowledge of health is very key. So there's a lot of health education that should be engaged to everyone right from when you're in school, either at home or in school or other places you go to. And it's that kind of knowledge that helps you with manage your health at the early stages. When you are working, it's also very good that the institution provides a platform for health awareness. You go for a job interview, you get employed, you have to do a health check. That's the beginning. Then you work, then you're very stressed. The awareness, a bank has to have an awareness program. We in Skybank, we have quarterly health checks. We have a portal where we have health information and tips all the time. And we ensure that most staff do some level of rudimentary health tests every quarter. We bring in people, experts, health assessors to come and do that. And you'll be surprised what we find sometimes. So we do a lot of awareness building, education within the bank. And it has helped a lot of people focus on their health. It's helped with their lifestyle. And when you're healthy, that's when you can focus on your work and do things very well. Thank you very much.
Ladies and gentlemen, I think just in the 3-5 minutes I have, all I would like to throw up would be, in terms of robust finance, robust health, is first to give you an idea. I mean, it's to say very clearly that money drives the healthcare system, just as it does many other activities in a modern industrial society. So we can't run away from the fact that finance is very important. And I just looked through some of my old papers, and I tried to pick some figures to give you an idea of how healthcare has moved in the United States, for example. Total healthcare spending in 1929 in the United States was about $3.656 million. $3.65 million in 1929. By 1965, it had gone up to $41 million. $41 billion, sorry. I was saying 3.65 million, that's 3.6 billion. I think we're very familiar with billions now, the way our pension funds and things go. So let's use billions. So $3.65 billion was cost of healthcare in 1929. In 1965, it went up to $41 billion. But then by 2002, it became a $1 trillion business. That's $1.5 trillion. And that gives you an idea of the kind of money that goes into healthcare. So at that time, we found that each person in the United States was costing, or was at least was spending, one way or the other, about $5,500 per person for healthcare. So you can see how it has transformed. I don't have time to say why it has transformed, but let me just very briefly say that healthcare has changed. Before, you had a doctor in his consulting room. For those who watch television abroad, he had his black bag and he would go visiting. Today, healthcare is multi-sectoral, like you've heard. Everybody is involved. There's so many people involved, and they're specialists in their own right. So the intensity and quality of service for healthcare has improved, and we must take note of that. Now, the question in terms of finance and health, again, is how do we pay for it? Do we go to Mr. Grosimier in Skybank and borrow money? We're talking about LiveWell Initiative. We're talking about health being the absence of the feeling of well-being, the absence of disease and all. There's so many other things that government would need to do. And I think that's where Dr. Lunge comes in terms of family health, public health and all. How do you prevent the diseases? And government now spends more money in this respect, so that at the end of the day, we're much healthier persons. And of course, if we're much healthier persons, then our country should be a much wealthier country. I think that's the way I would like to present it. I hope I haven't overshot my time. Thank you very much.
I will just be talking more on what it takes to have robust health. If you ask anybody on the streets what health is, he will tell you that when you feel well, you are healthy. And actually, dictionaries define health as being the condition of the body or the state of being free from illness. Some will tell you that also the state of physical, mental, and social well-being. And it's quite close to what wealth also is. Because wealth too is defined as what you have, and that is the absence of poverty and the presence of sufficient resources, which could be in terms of naira, kobo, property. When God made man, man was supposed to be in abundance of both health